All right, welcome to Module 5. This week we are going to be diving into different types of emotional and behavioral disorders. There's some chapters in the textbook that we're going to be addressing and going through a lot of reading, but we're going to break it up so it's not as intense going forward. So again, thinking about different types of disorders and how they all fit within this umbrella of emotional and behavioral disorders or emotional disturbance, or all the different definitions or different titles that we're using in this work. So here we go. So first, you'll notice in the book, here are the different types of disorders. And I thought it was interesting. The authors, Landrum and Kaufman, talked about how they decided to separate these into different chapters, but really we can't look at these different disorders separately in different boxes because we see some overlap. But we think about attention and activity disorders, specific conduct disorders, where we're going to see a lot of externalizing behaviors, and then going into some of the internalizing things that we might see. So anxiety, depression, and suicidal behavior, disorders of thinking, communication, and then just some special problems of adolescence. So yes, that's 1, 2, 3, 4, 5, 6 chapters of reading. But what we're going to do is we're going to break this up a little bit and have you read one chapter and really summarize that information going in that chapter. So I mentioned this a little bit, but there's some complexities in this work, and we think about these different types. There's a whole bunch of different aspects of emotional behavioral disorders. I know, like when I was in school and so forth, I think we tend to maybe look at some of the externalizing, so thinking about conduct disorders that results or manifest into some super intense behavior that's right in your face. That's maybe what we correlate with emotional disturbances or emotional behavioral disorders. But we know that there's a lot of other types as well, and thinking about how we might see a lot of different things going on. And just like I said, the authors said they're separated into chapters, but really a lot of these disorders of all types are connected. And it's just thinking about specific ways that children exhibit these disorders and so forth, and you can read more in kind of the opening. So basically, here's how we're going to do this in terms of our summary, an assignment for this week. Everybody read that kind of the opening, which is going to be right at the beginning of chapter 8. And then there's a sign-up sheet within Canva that you can sign up for your specific chapter. I put 2 spots when I'm recording this right now. We're not sure how many folks we'll have in our class, but we might change some things. But as long as there's an open spot, go ahead and choose that chapter. If there's one that's really you find interesting and want to learn more. If we have some folks and we don't have a chapter represented, then maybe think about just picking that one so that we can have at least a chapter per person. So basically what we're going to do is we're going to choose one chapter, and you're going to read that thoroughly about that specific disorder, and then you're going to summarize this, and that's going to be one of your main assignments this week. So after reading that chapter, here's what I'd like you to do. I'd like you to develop a summary of the information regarding that specific disorder. And what I want you to do is do this in some type of format. I'll show you a couple of examples of a Padlet or a Google Drawing, but the only kind of can't do is a Word document or a Google Doc just listing information. Let's think a little bit outside the box. Let's summarize this information in a little bit more visually appealing way. But here would be the key things that you would want to include. So when you look through the chapters, most of these chapters are going to include these sections. There might be 1 or 2 that aren't right there in the chapter, but some type of definition and or say characteristics of that specific disorder. Is there information about the prevalence of that disorder and how much we see? There might be some information around the relationship of this disorder to others. There's some possible causal factors. So what do we see that causes this? And then what are some ways to prevent that specific disorder? How do we assess for that? And then what are maybe some intervention and education information, so forth. So, or any other pertinent information that you would want. So that's 1, 2, 3, 4, 5, 6, 7, 8 categories. You want to have at least 5 of those. Again, if they're described in your chapter, more information about that assignment is in the module, so you can read through that. But again, I'll show you a couple of examples of what we've seen. So here is one using Google Drawing. So not a ton of information here. Oops, sorry about that. Not a ton of information here, but like, so some ideas of characteristics of ADHD, some relationships to other disorders, the prevalence, some general information, so forth. That was done using Google Drawings. The one up here is used Padlet, if you're familiar with Padlet. But again, kind of here's the definition, some prevalence around that disorder, some info, some characteristics. I found a video on what is ADHD that was actually linked in the chapter. So I added that so that you can basically look at it different ways. And then hopefully we'll be able to post these in some type of virtual gallery walk that our classmates can look at and learn more about each of those disorders that they didn't read. So again, think about it how you want to do it. But use some of the tech tools that you probably are really familiar with in your work experience to create a summary based on that chapter. So that'll be our main assignment for week 5. So before we go any further, I want to talk a little bit about internalizing behaviors, because I think that's something that's becoming more and more prevalent in schools. And it gets a little tricky. And I think that's one of the reasons why I want to talk a little bit about it. And then I want to talk a little bit about some exciting work that's happening around school-based support and mental health support, and how schools and districts are really working to be more efficient and effective with how they provide mental health supports to students. And it kind of goes along with this idea of internalizing behaviors. So here's the challenge, and I think this is really, again, something that I see a lot in the districts that I work in and schools, is that we have these environments and schools that are super busy, a lot of kids, a lot of things going on. We have staff who are navigating multiple agendas. They have so much pressure on them and a lot of things to do. And this environment in a whole is just kind of high stress and demands. So oftentimes we see staff will intervene when those problem behaviors we see are more noticeable. So they get to that point where it's interfering with learning of the student themselves or others. And that's what more likely we would call externalizing behaviors, the physical aggression, the breaking or materials of chairs and things of that nature. Like that happens and we have to address it. The internalizing behaviors, right, the anxiety, the depression, those are sometimes hard to notice because we have everything else going on. So we do a lot of different things. We screen, we use screening tools, which we're going to talk about in week 6, to identify students who might need additional support that maybe aren't showing up on some of these externalizing behavior measures like office referrals or things of that nature. So we do some things, but I think sometimes still we miss kids. We miss kids because we don't necessarily have a great way of looking at data and identifying kids who might not be having that noticeable behavior. So I think that's a key thing to think about when we think about internalizing behaviors. We know that there is more and more info coming out around the challenges for children and their mental health, especially since the COVID-19 pandemic. Here's some data, obviously. So we have some mental illness that's rising. Before the pandemic, 1 in 5 children had a diagnosed mental health disorder. Now we see common mental illness such as anxiety and depression that are increasing by quite a bit, and so forth. So we know that this is an issue. Excuse me. We know that mental illness is a risk factor for suicide. So look at the information and the data before the pandemic versus after the pandemic, where now suicide is the second leading cause of death for youth. So it's pretty significant challenges that are happening right now. We also know that when we think about disproportionality and, thinking about students who are Black or Latino, Indigenous children, they're often disadvantaged because in the mental health services, because of things such as prevention or even access and so forth. And we have some disproportionate data in terms of the support getting provided. So again, some barriers and challenges to mental health care. And then we also know that when we think about it, school mental health really matters, right? So we know that the vast majority of students who receive mental health services do so in schools. We know that positive school climate and thinking about social emotional learning is going to improve school safety, and we're going to decrease things such as bullying and so forth. We have some data that says when we specifically and explicitly teach social emotional learning, it improves academic performance and so forth. So we know that school mental health matters because schools are that primary mental health service provider, which is a really big responsibility, and it calls for this work that needs to be more effective and more efficient. And that kind of leads us to kind of what is happening in the schools. So we're going to talk about this at length in week 7, but if you if you're not in a school that maybe implements a framework or a tiered approach, such as multi-tiered systems of support or MTSS, and then specifically to social emotional behavioral support, such as PBIS or positive behavioral intervention and support. Obviously, a lot of schools, I think there's over 30,000 schools across the country that are implementing PBIS as a way to basically provide this organizational framework for delivering a continuum of support for kids. So again, we're going to talk about this in week 7 more, but thinking about this in terms of, okay, what are the school-wide supports that we provide? So thinking primary and preventative supports, and that's what we do in what we call Tier 1. And we know that that's going to help a vast majority of our students. But then we also recognize that we have students who need additional support. And then we think about Tier 2 supports, which is more secondary prevention, and thinking about maybe some group-based supports. And then lastly, we have Tier 3 or super intensive individualized support for kids who are very high risk for both internalizing and externalizing behaviors. So a lot of schools and districts are implementing this framework that organizes how we provide supports for PBIS. And then here's some more information about MTSS. We think about how do we embed mental health supports into this framework of our supports for kids. So we think about like family and school community partnerships and how that's provided for all kids, and professional development for our staff, thinking about just how do we increase the overall wellness of our students and staff in our building. And then we might have Tier 2 supports that are a little bit more intensive, but not super intensive or individualized, but those students who might be at risk for mental health concerns. We might do some social skills groups, or we might do some specific supports to increase positive interactions with adults. And then we have tier 3 supports, which again are intensive for individualized kids who have serious concerns. And we do that through a number of different ways, such as person-centered planning, behavior intervention plans, etc. I'm not going to go too much into detail because, again, this will be the kind of the focus of our week 7. So again, a little bit more MTSS core features. We have teams that kind of help kind of decide what we're going to do. And we're going to talk a little bit about how do we include community mental health providers. We use data to make decisions. We use evidence-based practices. We make sure kids have early access by screening and making sure that we're identifying kids who have internalizing and externalizing behaviors and needs. We progress monitor to see how things are working. And then we provide hopefully some ongoing coaching. And again, this kind of leads us to your this program and how do we do that. So we'll again talk about that more. So then the cool thing that's really happening and taking off in a lot of different districts across the country is this idea of how do we integrate school mental health within this MTSS framework. And what that leads to is what's been called an interconnected systems framework. So basically thinking about it as saying, how do we prevent this school-wide system that we're doing with our educators and so forth through MTSS or PBIS, and then we have our outside community mental health providers that might be working in silos. How can we bring these folks together to provide a more effective and efficient approach to school mental health and behavioral support? So ISF, or Interconnected Systems Framework, is this approach that maybe thinks a little bit differently. And like I said, it's super exciting. They're starting to get some data now around the impact of schools implementing this integrated approach, and it's really has been impactful. So this is exciting. So here's some more information on here that you can access. But one thing I do want you to do is there's a brief, what's called a 101, Interconnected Systems Framework 101 fact sheet. That's going to be in your resources. Take a look at that and kind of read through, and you get a little bit of a better understanding of what we mean when we're talking about interconnected systems. And then there's also, well, first of all, here is kind of what we mean by ISF. So again, thinking about how do we structure our educational and mental health systems to interact in the most efficient way. It's guided by key stakeholders in both of those areas, and they can change things the way that we do, including the policies that we have in place. Another key messages around ISF is it's going to be a single system of delivery. And I think that's the key piece, is not siloed approaches, but how do we do this all together and really know that and think about how mental health can be accessed for all students. And then we use that framework, or that MTSS framework, to kind of guide our work. So again, this comes from this need to structure and process how we do things and kind of really try to prevent this siloed approach by building this single interconnected system. Here's some more information that you can find from pbis.org that can give you some more information as well. This is not required. This is for your use if you want to read it. But there is a quick video. It's about 5 minutes long that I do want you to watch. It just kind of gives you a little bit of a brief intro into ISF, a little bit to go along with that fact sheet. I put the link in here, but it will be in your resources as well. And then that leads us to our discussion for this week. So you have the 2 assignments. You'll have the summary of your chapter and then your discussion. So in your work experience, what I would like to know is, like, what are some of the externalizing behaviors that you see? And what are some of the internalizing behaviors that you see that are the most prevalent? And how do you, or how does staff in your building go about supporting students that have that show those externalizing and internalizing behaviors? Does the way you support students or identify students or determine what is the best way to intervene with students. Does it change based on externalizing and internalizing behaviors, and what are some of the things that we see the most? So just like with all our discussions, post your initial post by Wednesday night, and then respond to 2 classmates by Sunday. So this week, again, thinking about different types of disorders and how that work, how those all connect, and then what are some ways that school and mental health providers are supporting students, and how do we make sure that we're supporting students both with externalizing behaviors and internalizing behaviors is kind of our big focus for this week. All right, so thank you and have a great week. Reach out if you need to, but we will see you in week 6 if not. So thanks.